Women issues, so ovarian cysts, situations with endometriosis, sorry. Um, uh, People who have had biopsies and are waiting for results. Anything related to the female system or female reproductive system that are medical issues, I would highly suggest truly emphasizing that as much as you can. I'm not sure if USCIS expedite officers actually understand medical terminology related to women, but I have seen that when we are talking about those issues, those expedites tend to go through. It's great that there's some sympathy or understanding there. Sometimes I wonder if they did understand or were they just like, lady issues, I'm going to go ahead and grab this expedite because I don't want to deal with this topic. I don't know. But I would just suggest if you are a woman and you need a DACA expedite, that you talk to your OBGYN or to your gynecologist and see if they can write a support letter for your expedite, possibly. If you are in need of testing or biopsies or something like that, it could be very helpful to get that information and include it for your expedite request. Oftentimes, women do not get the care that they need. And so now is as good a time as any to reach out to your healthcare provider to have a review to make sure that if there are any medical issues, those can then be brought up in your medical expedite, honestly and ethically. So please, if you haven't had an eye exam, get the eye exam. Maybe there is something there that actually is a medical issue, and then use that for your expedite request. The same with dental stuff. So many clients need teeth pulled or dental surgery or other major things that they can't afford right now. Get the letter from the dentist recommending what you need done, and then use that for your expedite. And once you get your work permit, then go back to the dentist and get that work done if you can. So you want to make sure that you're thinking about health in terms of mental health, medical health, optical, eye care, dental care, any type of medical issue, very broad. These can also be things like educational disabilities, that's like an educational and medical disability. And you can take a look at what's going on with your kids or other household members that depend on you for payment of those medical care um, bills, or driving them to therapist appointments. So, for example, a child with autism who sees multiple specialists per month, the parent needs to be able to get them to those sessions. And so there's that kind of a thing as well. So the medical expedite is one of the strongest things that you can do to try to expedite your DACA. I hope this has been helpful. If it has, please give us a like, a follow, or subscribe. And also, we appreciate stars. Okay. Ahora, we're going to do some questions in Spanish next. Ahora, hay una pregunta. Abogada, buenos días. Mi hijo tiene DACA desde los 15 años, ahora tiene 25. Él ha estado renovando y le llegaba el permiso sin ningún problema. Su récord está limpio y nada ha cambiado, pero esta última vez renovó en noviembre y el permiso no le ha llegado. ¿Hay algo que se pueda hacer para acelerar el proceso o solo quiere esperar? Muy buena pregunta. Eso sí es un problema para muchas personas. Los tiempos de procesamiento de DACA han tomado demasiado hoy en día y muchas veces no es por ninguna razón. Nada ha cambiado, como usted dice, y simplemente usas está lento. Una opción es hacer una demanda, una queja en corte federal que se llama mandamus, pero típicamente esto cuesta tanto que gente no lo quiere usar y entiendo eso. Otra opción para su hijo sería considerar si puede hacer un pedido a su congresista, se llama Congressional Liaison Expedite Request. Es un pedido a, por ejemplo, la oficina del senador, a ver si ellos pueden acelerar el proceso por pedir a inmigración, a ustedes, si lo pueden mover más rápidamente. Tiene que calificar para un proceso de agilización si lo va a pedir.